Assalamu alaikum everyone, I hope all of you are doing well. In this video I am going to talk about hypertensive urgency. Hypertensive urgency and hypertensive emergency are the same thing, but the in organs are not damaged in the hypertensive urgency. Systolic BP when equal to 180 are greater than 180, and diastolic BP when equal to 120 are greater than 120 without in organ damage. This condition is called hypertensive urgency. So in the hypertensive urgency and emergency, the blood pressure elevation is the same, but the in organ damage are not there in the hypertensive urgency. Now, how to treat the hypertensive urgency? It should be treated within 24 hours by the per oral antihypertensive medications. So the per oral antihypertensive medication are captopril, which is the ACE inhibitor, and clonidine, which is the alpha 2 agonist, and the labetalol, which is the beta block. So these are oral antihypertensive medication which is used to treat the hypertensive urgency. Now, what are the causes of the hypertensive urgency? The causes are the non-compliance with antihypertensive medication. The patient is not using the antihypertensive medication properly. So this is the one cause. The other is the Cushing syndrome. In the Cushing syndrome, the cortisol level is elevated, and there is a minor activity of the cortisol, just like the mineralocorticoid. So it absorbs the sodium and absorbs the water into the vessel, so it can increase the blood pressure. The other are drugs. Drugs include the stimulant like the cocaine, LSD, and methamphetamine can also elevate the blood pressure. The other is hyperaldosteronism, in which the aldosterone level is increased, which will absorb the sodium and absorb the water, so as a result the blood pressure will be elevated. There is eclampsia, also a obstetric condition in which the BP is elevated. The other is vasculitis. This can also increase the BP, and the peuchromocytoma, which is a malignant condition in which the epinephrine and norepinephrine level are elevated. So it then causes the blood pressure to elevate. Now, what are the clinical features of hypertensive urgency? There will be severe headache, and there will be visual disturbances, and there will be altered mental status. So these are the three clinical features of hypertensive urgency. So this was all about hypertensive urgency. For more videos, subscribe, like, and share. So thanks for watching the video.